Moving to a new country is exciting, but navigating the healthcare system can be very terrifying. Don't worry, I've got your back. Hi everyone, Expats Toolkit is here today to help you navigate the healthcare system. So congratulations, it looks like you're on your way to that process, and I hope that I will be able to give you some good tips to navigating the healthcare system. In the United States, the healthcare system is very scary. It's expensive, and we all get caught up in the insurance and a lot of logistics of the healthcare system. But I'm here to tell you today that for most countries living abroad, it is a very simple process and quite frankly, inexpensive compared to the United States. Don't let unfamiliar systems and language barriers bite you in the you-know-what, because it's not necessary. Today, we will take out the mystery of the healthcare system. So buckle up and get ready because we're going to navigate through this experience. The system is not that complicated. I think in the United States, we have made it more difficult to navigate. If you like this information, please subscribe to my channel. I have many other videos uploaded. It's to educate you on how to move and live abroad. There are some essential steps that we must go through first in the process of navigating the healthcare system. Let's start with insurance. For most people, when you want to obtain a residency or a visa or some long-term stay within that country, you're required to purchase health insurance. And just like anywhere else, there's a wide variety of options. I would suggest asking for a really good healthcare agent that can help you navigate that policy. When we traveled to Turkey and Budapest, we sat down with our relocation agent and they advised us on an agency. So we spoke with them and discussed what we wanted covered in our healthcare. Questions you will want to ask your healthcare agent about the insurance is obviously, what does it cover? What are the deductibles? What is your payment, monthly payment or yearly payment? How do you file a claim? Will there be someone on the phone that you can call and discuss maybe a possible procedure that you want done, and they are able to speak to you in your native language? You also will want to find out if that insurance covers you while you're traveling. So if you decide to go back to the United States or visit another country nearby, will you be covered under that policy as you travel? Before you buy health insurance, you'll want to have some kind of carryover insurance that will cover you while you're traveling into this new country. So for example, when we left the United States, we made sure we had travel insurance that would take care of us up until the time we purchased the local healthcare insurance. You just want to have all your bases covered. I will say this, I'm very surprised at how inexpensive healthcare is abroad, and therefore when you have to pay out of pocket, you're kind of in shock, like this can't be real. So those are some things that you'll want to investigate while you're researching healthcare insurance. You'll also want to investigate dental care as well as optical care. When you go on your scouting trip, I highly suggest just taking a walk through or ask for a tour at your local hospital or medical facility that would be within your neighborhood or area of where you're going to live, and just see what it looks like. You want to feel comfortable with a facility. You want to know if it's been accredited. Does it have all the mechanisms that you expect a hospital to have or a medical facility to have? Maybe schedule some time to visit with a doctor. Want to interview that doctor and ask questions and see how comfortable you feel with the system. Our primary care doctor is within the hospital. So when you go visit the doctor, he is within that facility. Convenient because in US, obviously you go to a primary doctor, his office is probably not in a hospital, and any lab work, x-rays, any of the extras that they may ask for, you have to go to all those different facilities to obtain. The other thing you'll want to ask is, do they have an app? For example, do you have an ability to schedule an appointment online. We have an app that we use here in Turkey that provides us opportunities to schedule appointments. We can look at our medical records. All of these things are within that app. For example, if I go from Antalya to Istanbul, if something happens to me while I'm in Istanbul, I have access to all my information on this app. It makes it easy for the doctor to kind of know what's been going on with you health-wise. Another thing you'll want to research is emergency care. What hospital will they take you to, and how is that process handled? Do you need to file insurance, or will they file the insurance? Will your doctor show up at that hospital if you already have a set up primary care physician? You need to find out all those details about emergency care. I'm going to take a note of the difference between private and government hospitals. Now, most people will tell you that a government hospital, you're going to wait longer. Quality is probably not as good. I've experienced both and found that they're kind of on equal planes when it comes to your care, because obviously they want you well. Those are some things you'll just have to decide upon yourself. So it's really up to your discretion. Now you'll want to figure out, how do I find a local doctor? You want someone that you feel comfortable with, that speaks your language, that you can communicate with and reach out to if you have some concerns. I have found the best way to find that doctor is through other expats, through social media and asking the questions that what I'm looking for. Honestly, I can tell you that the best thing to do is to visit that doctor's office and sit down and talk to them. You'll want to know if your provider offers like vaccination or yearly checkups. You want to make sure that you can get all the exams that you need and you and the doctor have good communication. The other thing you'll want to ask, they file insurance. Do they expect you to pay a certain amount and then you file? What are those payouts and how do they work? In emergency situations, you want to be able to call for an ambulance. That's when you need to have written down either in your phone or somewhere all the emergency contact information. You'll want to be able to call an ambulance if you need one, call the hospital if you need to, call your insurance agent, so that if something arises and you need to reach out to them, you have access to that. If you haven't done it already, subscribe to my channel. I will be providing a lot of great information about how to move and live abroad. The link is below. Just hit the subscribe button. You'll get notified whenever I produce a new video, which I'm trying to do every week to share information about how to navigate these foreign systems that are crazy and make your life a lot easier than what I had when I moved abroad. Also, if you'd hit the like button, that also helped me in spreading the word about moving and living abroad. In the description box, I have provided you a checklist that you can download, and it goes through all the different things we're talked about here today, as well as guide you through some other questions you may want to ask either the healthcare provider or your insurance agent. Moving on to the pharmacy. Pharmacies operate very differently here, especially in Turkey and in Europe. Say, for example, if you have a sinus infection or you feel like you're getting a cold, you can walk into a pharmacist and explain your symptoms. They can prescribe medication for you without you having to go to the actual doctor. You also will find out that there's a lot of medication that doesn't require a doctor's script to get. So I would suggest on your scouting trip to walk into a pharmacy if you take a list of medications already and ask them, hey, do I need a doctor's script or can you sell me this over the counter? One thing you'll want to take note also is the hours of operation. I know that most pharmacies in the United States are open 24 hours, but in foreign countries, they do allow pharmacists to close on certain days. So at least one day off a week or so, they will be closed. They're not open 24/7, but there will be a pharmacist somewhere in your neighborhood that will be open. Although I don't have any serious medical conditions, I get copies from all of my doctors, and I had all of that uploaded to a cloud so that I could access it. And you will find out that it's much easier to obtain your medical records in other countries than it is in the United States, I think because of HIPAA. But you'll want to bring your digital copies with you when you first initial visit to the doctor, just because he's going to ask you a lot of questions about your past. If you just have all of this stuff already digitally uploaded to a cloud, you can just send it to his office. I love it here in Turkey because all my medical information is all on the app. I can easily print it out or I can discuss it with a different doctor. It's so much easier. I don't know why we don't do this in the United States. You know, in the United States, you have to go to each doctor to request your medical records and sign all these papers off and such. Here, all you need to know is your ID number and you can print off anything you need. Next thing you'll want to find out is, does your country require a vaccinations of some kind? You know, now that we've been through this COVID-19 scenario, a lot of countries have kind of calmed down with that requirement, but you still need to ask, what are the vaccination requirements if I want to become a citizen of this country, and make sure that you have all of that taken care of before you arrive. You'll also need to keep track of those records, just because as you move about, especially from visiting your home country to the new one, you'll want to have that documentation with you. I can't stress it enough that you want to make sure that the language barrier is not in the way when it comes to your medical care. If you come across where you find a doctor, you think he's very knowledgeable, you've had a lot of recommendations, but there's a little bit of a language barrier, get a translator. Lucky for us here in Turkey, every hospital facility offers a medical translator that guides you. I'm not sure how that works in every country, but you really need someone that speaks their language and your language very well, because there are going to be some things that you'll want to discuss and you don't want anything to be miscommunicated. So when you're doing your scouting trip, make sure to not only include visiting medical facilities, but also go and examine dental offices. I went to an eye clinic while I was here. Check out those things that you already know that you're going to need and go pay them a visit. The United States has you believing that they're the best healthcare system in the whole world. But honestly, I've experienced both, and I'm quite shocked at how much better the healthcare is in other countries. So don't let that fool you. I recently had my lens in my eyes removed and put in smart lens. I can't say enough positive things about that situation. The cost is so much less, as well as the care that you get at that facility is just amazing. What I love about medical care abroad is that it's affordable, it's more personal, it's done in a timely manner. You don't have to schedule an appointment months out. I mean, I go to the United States and I find out that they need a primary care doctor, but the earliest appointment is a month later. Or when my dad was sick with cancer, it took weeks to see the doctor for different things that he needed. I mean, I just don't understand that system, because when you're sick, you need to care for the doctor right away. Here, I find that it's very easy to see the doctor. I can even call the doctor right now, and it's mid-afternoon, and say, hey, I feel like I'm not feeling well. Can I come into the office? Boom, I'm in there. You know, my husband and I were traveling. He had a cap fall off of his tooth, texted the dentist, hey, I'm gonna be back tomorrow. Can I come in the office? He's like, yeah, come on in. So, and I can't say enough good things about medical care abroad. Now, granted, there's always good and bad doctors no matter where you live in this world, but for the most part, pretty good system. Now that I've armed you with knowledge about healthcare abroad, I'm hoping I'll make you feel more comfortable, because usually this is at the top of the list when it comes to making that decision to move and live abroad. Remember to subscribe to my channel for relocation hacks, other tips and advice I can give you about moving and living abroad. You'll find all kinds of information, from relocation to renting an apartment to should you buy a car or use public transportation. I've gone through everything. So I'm trying to cover all the bases of living abroad, and hopefully will help you in that process. If there's any questions you have about healthcare or anything related to moving abroad, please reach out to me in the comments, as I will try to answer your questions. Don't be shy. Definitely reach out to me and let me see if I can help you. I hope this was helpful to you, and I wish you well and have a great afternoon.